The idea of administering growth hormones to young children with idiopathic short stature remains controversial today. But if a child with growth hormone deficiency was given that opportunity to fit in and become normal, then why not give them that chance? In an effort to enhance and improve their quality of life, I feel that growth hormone therapy may be necessary as it can help accelerate their growth and normalize their height as adults. Children expected to be shorter than the average may benefit from growth hormone treatment and also enhance their growth patterns as well. Since every child wants to be cared for and treated for the same way, why should any child with growth hormone deficiency be any different? And if growth hormone therapy may improve a child's quality of life, I feel that any child is deserving of this choice. So how do growth hormones work? Well, growth hormones may lead to growth acceleration and normalization of height in children during their childhood. There are both short-term and long-term effects of growth hormone therapy. The long-term use of growth hormone therapy have shown that it can normalize adult height in about 85% of children with short stature that are treated with growth hormones. Here's a graph, and the first graph right up here is just a growth rate, and the bottom right here is a graph, of the standard deviation score for height. And as you can see, it is increasing after each year, and there is a shaded part right here. The shaded area just basically is the normal height, what is considered the normal range in height. So are growth hormones safe and effective? Well, first of all, growth hormones are FDA approved, and recombinant human growth hormones are safe as long as it is administered responsibly by a physician and as long as the side effects are carefully monitored. Also, there are some studies that show that growth hormone treatment in children born smaller for gestational age do not appear to affect their bone age or their pubertal development. There are also no unexpected safety concerns during the growth hormone trials that have been studied and carefully monitored. So, can growth hormones help with patients' psychological or behavioral problems as well? Well, quality of life assessments, some assessments were given to patients, and for growth hormone deficient patients, and they reported back receiving lower scores than normal controls. This just basically means that after growth hormone treatment, these growth hormone deficient patients reported being happier and experienced less illness as well. So this shows that the psychological improvements have also is also a part of growth hormone therapy, and it can help with the patient's improve the patient's perception of energy level and their mood. Also, in growth hormone therapy, it can help ameliorate behavioral problems. So in one study, children with behavioral problems also begin to ease, and it will help benefit with that as well. So although the administration of growth hormones remain controversial, and there are certain aspects that studies are still trying to figure out, there are nonetheless obvious reasons for why growth hormone treatment may be beneficial for children with short stature. They can benefit from both short and long-term treatments and improve their mentality on life. And most importantly, the usage of growth hormones is by far is safe and effective as long as there is careful monitoring and administered responsibly. Thank you.